Our next contestant is Yichi ZHANG, breaking the wall of limited access to health services. Yichi, please. Please unmute yourself, Yichi.
Good afternoon, everyone. The COVID-19 pandemic has disrupted the healthcare systems globally and will continue to shatter standard of care in 90% of the countries. The whole population, especially those who have chronic conditions or older ages, are disproportionately affected. Fortunately, new health technologies have been introduced to facilitate and improve health outcomes through early intervention and routine self-monitoring, as well as alleviating the burden of the health system. However, not every individual could benefit equally. For example, in Singapore, at least 1 in 10 households are digitally underprivileged. So how to break the wall of limited access to health services? Different from the Euro telemedicine technique, our design concept is to build a telehealth infrastructure inside this booth shown on the slides by integrating health screening with a health ambassador program, a consultation platform, as well as a follow-up care from medical institutions. The booth was designed for mass swabbing tests, so it's both physically and psychologically safe, and its modular design could enable easy adaptation required by our service. The booth locations were selected, so they are distant from healthcare institutions, but near the neighborhood. Our pilot was done early this year with different health tests incorporated, shown in the diagram. For example, blood pressure, heart rate, glucose level, BMI, and an AI-assisted eye screening. In total, 66 trained volunteers completed 627 screenings, and 26% of the users were referred for follow-up care. The ground feedback received has been positively overwhelming. A key success factor in our service was to get all stakeholders' involvement and co-ownership. We conveyed it as by the community, for the community. Our model served as a successful proof of concept and demonstrated a unique hybrid digital physical platform that can add value to the existing public and private healthcare services. In future phases, we will include more health tests to address the needs of healthy aging. We will continue improving this accessible and scalable community telehealth access to accelerate the uptake of telehealth as a novel community care model. And we will provide students, community and industry partners, and the residents in Singapore with a sustainable platform for research and service learning. Thank you.
Thank you, Yichi, for a wonderful presentation. Our next contestant, if there is any question, yes, please.
Which specific services, health services, are you offering with your health booth? Because you have also a lot of health gadgets where you can do it also at home. Certainly you need the health gadget. Can you elaborate on this?
So in literature, it has shown that the health literacy and also the digital literacy of the residents are not high enough. And from our pilot statistics, we also see that many of those who have chronic conditions don't do self-monitoring at home or go to hospital for the routine self-monitoring. So our booth, what we provide is that we have health ambassadors and student volunteers to help our residents with this health monitor.
Thank you.